Welcome to our lecture on emerging zoonotic bacterial infections. We will explore the complex interactions between humans, animals, and the environment, investigating the transmission routes, pathogenic mechanisms, antibiotic resistance, and prevention strategies for these infections. In recent years, the identification of new zoonotic bacterial pathogens has been on the rise. This poses a significant public health concern as these emerging pathogens have the potential to cause devastating outbreaks. Understanding the emergence, epidemiology, and pathogenesis of these infections is crucial for effective prevention and control measures. In this topic, we will explore some of the most notable emerging zoonotic bacterial infections and discuss their impact on global health. Zoonotic bacteria rely on animal hosts for survival and replication. Understanding the diverse range of animal reservoirs is essential for identifying potential sources of infection. Additionally, exploring the various modes of transmission, such as direct contact, aerosols, foodborne, or vector-borne routes, allows us to comprehensively assess the risk factors associated with zoonotic bacterial infections. In this topic, we will delve into the intricacies of reservoirs and transmission routes. The success of zoonotic bacteria in causing disease lies in their ability to interact with and exploit their host organisms. These interactions involve a series of molecular processes, including adhesion, invasion, immune evasion, and toxin production. By understanding the strategies employed by zoonotic bacteria to establish infections in both human and animal hosts, we can develop targeted interventions to mitigate their impact. In this topic, we will explore the fascinating world of host-pathogen interactions. Zoonotic bacteria possess an array of virulence factors that enable them to colonize and multiply within a host, evade immune responses, and cause tissue damage. Investigating these virulence factors and the underlying pathogenic mechanisms can provide vital insights into the development of effective therapeutics and vaccines. In this topic, we will unravel the intricate details of the molecular mechanisms employed by zoonotic bacteria to cause disease. Antibiotic resistance poses a significant challenge in the treatment of zoonotic bacterial infections. The widespread use of antibiotics in both animal agriculture and human medicine has contributed to the emergence and dissemination of antibiotic-resistant strains. Evaluating the prevalence and understanding the mechanisms of antibiotic resistance in zoonotic bacteria is crucial for guiding antimicrobial stewardship efforts and developing alternative treatment strategies. In this topic, we will assess the prevalence, mechanisms, and implications of antibiotic resistance in zoonotic bacterial infections. Accurate and timely diagnosis is essential for effective disease management and control. In this topic, we will explore advanced diagnostic techniques such as PCR assays, serological tests, metagenomic sequencing, and molecular fingerprinting methods. Additionally, surveillance systems play a crucial role in monitoring the epidemiology and trends of zoonotic bacterial infections. We will examine the principles and applications of surveillance in this context. Prevention is the cornerstone of combating zoonotic bacterial infections. Strategies such as vaccination, implementation of proper hygiene protocols, and targeted public health interventions can significantly reduce the burden of these infections. In this topic, we will delve into the various prevention and control strategies that are crucial in mitigating the transmission and impact of zoonotic bacterial infections. The One Health approach emphasizes the interconnectedness of human, animal, and environmental health and recognizes the need for collaborative efforts between various disciplines to effectively manage zoonotic bacterial infections. In this topic, we will explore the importance of interdisciplinary collaboration, surveillance systems, and shared resources in addressing the complex challenges posed by zoonotic bacterial infections. When zoonotic bacterial infections lead to outbreaks, rapid and efficient investigations are vital for controlling the spread and minimizing the impact on public health. In this topic, we will discuss the epidemiological tools and approaches used to investigate zoonotic outbreaks, including outbreak detection, source tracing, and outbreak management protocols. In this topic, we will dive into specific zoonotic bacterial pathogens in detail. We will explore their biology, epidemiology, clinical manifestations, diagnosis, treatment, and prevention strategies. Case studies on notable zoonotic bacteria such as Salmonella, Campylobacter, Brucella, and Yersinia will be presented to illustrate the diverse range of zoonotic infections and their associated challenges. Certain groups, such as the elderly, pregnant women, immunocompromised individuals, and children, face unique challenges when it comes to zoonotic bacterial infections. In this topic, we will examine the specific vulnerabilities and considerations associated with zoonotic infections in these special populations. Understanding these intricacies is crucial for tailoring preventive measures and providing optimal care to these vulnerable individuals. Zoonotic bacterial infections have a significant global impact, affecting human health, animal welfare, and economic stability. In this final topic, we will reflect on the global burden of these infections, their far-reaching consequences, and the challenges we face in managing them. We will also discuss future strategies and research priorities aimed at preventing, controlling, and ultimately eliminating zoonotic bacterial infections. Understanding zoonotic bacterial infections is crucial for future medical professionals. By comprehending their complexity, host-pathogen interactions, transmission dynamics, and challenges, we can protect public health and combat these infections effectively.